So, Kayla, I know when you and I were sort of preparing this segment and sort of talking about, what things we needed to cover, you discussed part of your journey, right, with anxiety with me. And so I was hoping you might be willing and open to sort of share some about what it was like to kind of walk that path and sort of how it has formed and sort of molded you. So when did you first realize that you were experiencing symptoms of anxiety, and sort of how did you know?
I realized at a pretty young age, I would say around middle school or even a little bit before. Um, but at the time, I didn't know what it was or
Mhm.
if it even had a name. I just would feel all the symptoms of anxiety, and it may look different for everyone, but for me, it was restlessness and not being able to sleep at night, stomach pains, feeling nauseous, and uncontrollable shaking. So yeah, these are very scary to experience as a kid. And in severe cases, I would even get attacks. So that was also very terrifying.
Yeah, I can imagine how impressionable that could be, certainly as a young adult. So, how has living with anxiety sort of affected your daily life, both inside and outside of the classroom?
So I think I've always done well academically. I'm one of those people that also have performance anxiety or
Hmm.
test anxiety. So that has gotten the best of me a couple times. But other than that, academics hasn't really been an issue. It's more in my personal life. Because I've had it for such a long time, I know how to deal with it now. But there were times when I experienced a severe anxiety attack, and I had to go to the hospital or the ER. That's obviously scary, but it has gotten better, and I haven't had to go to the hospital for a while now. So the counseling that I've been to, the therapy, and the medications that I'm on has definitely helped.
Yeah, that's great.
Mhm.
Um, I think one of the other pieces of dealing with anxiety, but really anything. And I mean, we're talking about you specifically with your path with anxiety, but that certainly this applies to many other, um, mental disorders that are out there. But they do face a lot of undue stigma, right? Stigma that certainly doesn't deserve,
Mhm.
right? But nonetheless, it's there. So, have you faced any of that? Have you faced any of the stigma or misconceptions out in the public about having anxiety, and sort of how have you coped with those and dealt with those?
Plenty of times. Yes, I've been told to just relax or to stop being dramatic and that it's all in my head. And, that's never great to hear when you are experiencing these very physical symptoms that I
Mm-hmm.
mentioned earlier. But I try not to let those type of comments affect me or think differently. I come from a culture and a family that doesn't really talk about mental health and kind of just brush it under the rug. So growing up, I didn't really know who to go to or who to talk to. And I think that's another reason why I feel so passionately about this topic and this initiative and yeah, why I'm a part of it.
So I guess reflecting on your experiences and how you've encountered these stigmas and misconceptions, what do you think are sort of the biggest misconceptions about mental health disorders that college students might have?
Yeah, I think the biggest misconception is that it's only temporary,
Hmm.
which might be the case for some people, but it's not for others, or that it's not real, or that maybe they think they're weak and they need to toughen up, but this isn't the case. And like I said earlier, it's okay to ask for help.
Yeah, absolutely. So you mentioned seeking for help. So now, how did you do that? Did you seek help? Sort of what helped you to take that step to say something's not right? I need something more.
Mhm. Yes, so I actually used counseling services that were available to me at Auburn. I went to Auburn for undergrad.
Okay.
So I went to counseling for a while and tried to do non farm things. Now, non farm things just basically mean um, stress reduction and self care practices, anything that is not taking a medication. And while these worked for a while, I knew I needed to be medicated for my anxiety. So I went to my primary care provider, and she was able to help me and prescribe me medication for when I do experience an attack.
Awesome. So, I know you mentioned you just went to or you utilize your primary care provider to sort of help you
Mhm.
navigate that path to getting your anxiety um, under control. So, I guess what has your experience been like, sort of navigating these different
Mhm.
techniques and non-farm, as you mentioned, or
Mhm.
medication?
Yeah, my experience so far has been pretty good. Through the professional help that I received, I was able to control and treat my anxiety and why I feel so comfortable talking about it today here on the radio. Since I'm in pharmacy school, I knew even before seeing my primary care provider what kind of medication I thought she was going to put me on. So I loved having that knowledge and advantage, and I know it makes their job much easier.
So, sort of closing out this part of the segment, sort of what would be some advice that you would give to other students who might be in your similar shoes, or dealing with struggles that are sort of in this same sort of domain? What advice would you give them?
My main advice would be that it is more than okay. In fact, it's encouraged to seek help. Go to therapy, go see your doctor, go see your pharmacist, even, and they can help you lead to um, resources that you probably weren't aware of before, and it will never hurt to try.
Absolutely. Well, thank you, Kayla, for being willing to share that. I know that it's not always easy in the context to come in a public forum and talk about something that in some cases is uncomfortable, that caused you or that can cause duress in some scenarios. So really, I really do appreciate it. It does seem like there can be great freedom that can be gained just by acknowledging that something's not normal, or you need help, and going and ask for it. So again, thank you again for your openness and sort of sharing your experience, as we can work to, as you mentioned, continue to keep these important conversations going about mental health. I wanted to follow up on something that you introduced back there about sort of how mental health disorders can be addressed, right? How they can be managed. You mentioned things like going to counseling. You mentioned medication, but sort of how do these come into play in the management of these mental disorders and mental health challenges?
Right. So, just like treating someone with high blood pressure or diabetes, mental health disorders can be treated with medications. And, like I said earlier, non pharmacologic. So, basically, any therapy that's not taking a medication, like diet modification, stress reduction, going to therapy, going to see a counselor. Therapy and counseling can be super beneficial for a lot of individuals. In fact, up to 80% of patients who undergo therapy experience significant improvement in symptoms. In other instances, a medication like an antidepressant may be warranted and can be very helpful as well. Even combining therapy and medication can often enhance treatment effect and success. The issue is stigma. Like Dr. Helmer, you mentioned earlier, there's still stigma behind taking a pill for your mental health disorder, and there really shouldn't be. Like I said a second ago, it's the same exact thing as someone with any other chronic disease. For example, someone taking insulin for their diabetes. We shouldn't judge someone for that.
Yeah, absolutely. I mean, I think mental health disorders are, it's a chronic issue, just like, diabetes or hypertension. And we have ways that we can effectively manage it, whether it's with medication or without medication. And so, yeah, I agree. We shouldn't judge people on something that not their fault. It's something, it's biologic in nature, and we need to work within those realms.
Right.
Um, so I know you just mentioned medication as a possible treatment option. Obviously, as a pharmacist myself, and you as a student pharmacist, we understand that although medication isn't the sole remedy for many of these mental health challenges, they are commonly utilized, right? Which I think underscores the importance of ensuring that medications are used the correct way and how they're supposed to. So earlier you introduced the Script Your Future initiative. So can you tell us a little bit more about that initiative, sort of what it is and how it comes into play, what we're doing with it this semester?
Absolutely. So, Script Your Future is a national public education campaign aimed to raise awareness about the importance of medication adherence as a key first step to improving health outcomes. There are many different reasons why people don't take their medication as they are prescribed and as they're supposed to, such as cost, just simply not being able to afford it, or just forgetting to take it. Even the fear of side effects or uncertainty about effectiveness, which are all valid. So it's important to meet people where they are and help them address their individual challenges or concerns about taking their medication. For our Script Your Future initiative this year, we have chosen to focus on mental health medication adherence among college students. This is so important in the context of mental health among college students because of the growing prevalence of mental health disorders in this population and the stigma behind treating it. I feel like it's my obligation as a future healthcare provider to have these conversations with my patients. And I'm just really thrilled to be starting now as a student through AAPP and the Script Your Future initiative.
Yeah, and I liked how you sort of mentioned all these reasons that, you know, anyone, not just college students, but anyone might forget to take their medication. Cost, forgetfulness. You know, I thought those are some good ones. You know, one of the other challenges that I think of that maybe is a little bit more specific to college students, sort of a younger population of patients, is there's often this sense of almost invincibility, right? That we're young, you know, there's not much known. You feel invincible, right? That nothing can hurt you, right? That you are always going to be healthy. You're currently healthy, always going to be healthy. And it's sort of hard to move past that sometimes. And I think that combined with, you know, the fact that many of the medications that we use, you know, you mentioned antidepressants, for example, but many of the medications that we use for mental health disorders don't often have an immediate impact, right? Things like antidepressants, for example, are incredibly effective, but can take weeks up to a month to really become truly effective. And so in conditions, these mental health disorders where, you know, there are physical symptoms, sometimes it can be maybe frustrating, I guess, to know that you're maybe taking a medication, but maybe not see an immediate impact, right? So there can be just this lack of a perceived sort of need to continue taking it, or not as much of a desire to take it when there's not this sort of immediate cause and effect when taking a medication. So I know earlier you talked about some of your responsibilities as an AAPP officer within the College of Pharmacy, along with the Script Your Future initiative. So tell us how all of this is coming together this semester, and specifically, how can students at South benefit?
Yes, so we are very excited to be hosting the Mental Health Fair at the Student Center Terrace on March 17th, which is a Monday, from 11:30 a.m. to 4:30 p.m. We will be offering anxiety and depression screenings, as well as blood pressure and blood sugar testing. We're also going to be offering education on medication adherence and collaborating with SSWO, the social work organization at South, to provide some very valuable resources on where to go for help if you need it. This event is open to all South students and is completely free. I'm going to repeat that. It is completely free to all students. And we hope to meet a bunch of y'all. And even if you feel this event isn't for you, maybe you know someone who could benefit. So please stop by and just chat with us. And we'll be giving away some fun goodies as well. And there will be service dogs and service cats. So
fancy.
Yeah, come by and have fun.
All right. Well, I think that's all the time that we have for today. Again, we're very appreciative to 97.1 The Prowl for letting us come in and talk a little bit about our profession, our College of Pharmacy, and most importantly, these student initiatives that we have this spring. So again, please consider stopping by the Mental Health Fair. You know, Kayla mentioned, even if it's not for you, it could be for somebody you know. We talked about the statistics earlier, right? 1 in 10 students. So there's a very high likelihood that in your immediate friend group, right, there's somebody that's struggling, whether you know it or not, with some of these issues. So come on by, talk to us. Again, the Mental Health Fair is Monday, March 17th from 11:30 to 4:30 at the Student Center Terrace, excuse me. So we hope to see you there. Have an amazing rest of your day, and go Jags.
Go Jags.